Do you feel dizziness or spinning when you go to the dentist? Does that cause you not to go to the dentist to get regular teeth cleanings when you need them? Do you feel dizzy immediately after you leave the dentist or when they sit the chair back up? Did you get a vertigo attack within a day or two or maybe 3 days after you had a dental cleaning or procedure? Many of my patients describe getting dizzy at the dentist, right after the dentist, or within a few days of going to the dentist. When they contact the dentist to tell them about the symptoms, the dentist usually says it doesn't have anything to do with the care and may not offer an explanation that's helpful. Some dentists do offer a helpful explanation, but frequently my patients are left bewildered and uncertain exactly what happened to cause dizziness or vertigo at the dentist, after the dentist, or within a few days after a dental appointment. In this video, I will cover undetected and invisible causes of vertigo at the dentist. Make sure you stay until the end so I can share with you some helpful tips that I offer to my patients who get dizzy at the dentist. But first, I'm the vertigo detective, Dr. Kim Bell, DPT. I'm a licensed physical therapist. And this is a reminder that this video is for educational purposes only. This is not individual medical advice. I want to start by talking about one of the most common causes of dizziness at the dentist. This is BPPV, or ear crystals. BPPV stands for benign paroxysmal positional vertigo. This is a condition that is not a disease, it's not a pathology. That's why the B stands for benign. Paroxysmal or paroxysmal means it comes and goes. So the dizziness is typically not constant for the most common type of BPPV. The dizziness will come and go in certain positions, and that's the next P stands for positional, meaning when I recline in the chair at the dentist, I feel a wave of dizziness or nausea or a spinning feeling. And then maybe when the dentist sits the chair back up so that I can get up and get out of there, I get another wave of dizziness or nausea or a spinning attack. So this would be a positionally triggered vertigo symptom. Typically, it lasts for less than a minute in most cases. And then the word vertigo describes a feeling of spinning, tilting, sliding, or falling when you're not doing any of those things. You're literally just lying back in a dental chair, but you might feel like you're falling through space. You might feel like you're spinning as if doing a cartwheel or rolling in a barrel or something like that, but really you're just lying back in the dentist chair. And if you do feel that false sense of movement when you're reclined in the dental chair, or when you're sat back up at the dentist, then you might have that BPPV. Those are the ear crystals. It's one of the most common causes of dizziness or vertigo at the dentist. It's typically triggered by either reclining back or sitting back up for the dental work. And it's a benign condition that can be treated and resolved by a healthcare provider who specializes in treating BPPV with crystal repositioning maneuvers. This is what I do all day long with my patients, and this is literally moving these crystals in your ear that are out of place back to where they came from to resolve the positional vertigo. And you'll know that this is resolved because the next time you go to the dentist, you can recline back in the chair and you won't have any dizziness, nausea, or vertigo. That's one of the first and most common causes of dizziness at the dentist. Another invisible and often undetected cause of dizziness at the dentist is a problem with your neck. Very often people who have upper cervical related dizziness or vertigo, which typically includes the first cervical vertebrae right below the skull or the second cervical vertebrae right below that. So that's called the C1 atlas bone or the C2 axis bone. If either one of those are out of alignment, and that causes you to have some neck stiffness, neck tension, maybe some neck pain, even base of the skull headaches, tension headaches. For some patients who get migraines, that can certainly cause migraines. And so this alignment of these bones in the upper cervical area of the neck can get aggravated by reclining back in the dental chair. And that is one of the possible causes of dizziness at the dentist. Now, one of the solutions I offer to my patients that have neck pain or neck stiffness or frequent base of the skull headaches is to put a roll behind their neck when the dentist reclines them. That can help to give some relief to dizziness from your neck when you recline in the chair at the dentist. And then the third potential cause of dizziness or vertigo at the dentist typically will occur after you've left the dental office, usually within a couple days, and that would be a strong feeling of spinning, and it would be sort of unrelenting, and it may even cause you to go to the emergency room potentially, and that may be due to an infection after going to the dentist. One of the most common causes of infection after going to the dentist is a flare-up of the herpes virus. So if you get a cold sore around your mouth shortly after you've had a dental procedure, then it's possible that you're having a herpes flare-up, and that can cause vertigo from the virus. So I talk about this with my patients. It's called a viral vertigo. And this can be lasting for days. This can be very strong. Frequently, patients will need medication, an antiviral medication to actually help with this. That can be prescribed by the dentist if you let them know you got a cold sore shortly after the dental work was done, or your primary care provider can most likely prescribe an antiviral medication for you if you have a strong onset of vertigo within a day or 2 or 3 or 4 days after you have dental work, coinciding with some kind of flare-up of a cold sore around your mouth, or some people call them fever blisters. So you can talk to your dentist, you can talk to your doctor potentially about medication management if you think that might be a cause of your dizziness after the dentist. Some patients actually pre-medicate with antiviral medication every time they go to the dentist if they've gotten cold sores or canker sores after the dentist in the past. Another possible cause of vertigo after the dentist would be some kind of bacterial infection or an abscess in your mouth. And this would be sort of like an adverse outcome of a dental procedure. Potentially, if you got an infection, this would typically require a follow-up with the dentist or oral surgeon, whoever worked on you, so they can check it out. They might need to do some further work on you, or they may give you some antibiotics or something like that. And certainly a bacterial infection that develops after dental work can cause dizziness or vertigo to start within a couple days after the dentist. Finally, one other cause of dizziness after the dentist could be a migraine. So some people just being reclined in the dental chair, all the stress, the pushing and pulling on your head and your jaw, maybe drilling, maybe, different things they're injecting into you to numb. This can cause a migraine for some people that are sensitive. So if you have a headache after the dentist, you can do interventions to resolve the headache. And some people who have a tendency towards migraines can get an episode of dizziness or vertigo that's called a vestibular migraine. Now, this could be strong dizziness, strong nausea, strong spinning, and it typically will resolve on its own within 3 days. So that would be potentially a vestibular migraine triggered from dental work. Again, this is only going to be a possibility in people that have a history of migraines either a personal history or a family history, and it may be missed and remain undetected because vestibular migraines don't always come with a headache. So now I want to show you the tips that I recommend to my patients when they are going to the dentist. Let's take a look here. If you go to my website, betterbalanceinlife.com, and over here you can see I typed in vertigo at the dentist, and then I searched, and here's what came up. These are the tips that I have published in this blog for my patients, and I share this blog with my patients if they get dizzy at the dentist. So first of all, you can arrange a ride, arrange transportation if you think you might get dizzy at the dentist. Another idea is to pre-medicate. So that depends, again, on the root cause of the dizziness at the dentist. And then you can ask for a pillow or neck support. Some patients will ask the dentist not to recline the chair back. And that's an okay short-term solution, but I'll tell you that actually creates quite a strain on the back and neck of the dental hygienist or the dentist or the surgeon. So it's optimal for your healthcare provider if you can figure out the root cause of the dizziness at the dentist and then do whatever you need to do to try to mitigate it or resolve it so that they can actually recline the chair all the way back and not hurt themselves while they're treating you. Now, I want to show you one extra thing here. If you want to learn more about this topic, you can go to my other website called vertigodetective.com. And here again, I typed in the phrase vertigo at the dentist and I hit search. And then what came up is the first article I ever wrote about the connection between vertigo and teeth, which was updated in 2024, but I think originally it's a few years old. And then I wrote another article because that one was so popular and I got so many questions about it. I wrote this one called Dental Vertigo, What Causes It? And I'll just show you real quick. This is a little review of what we've talked about. From the next strain, I actually talk about TMJ in here because some people with a TMJ problem, it can get aggravated if the dentist has to hold your mouth open for a long time. So TMJ can flare up after a dental work. And then again, the vertigo from BPPV, those are the ear crystals. Vertigo from a viral attack. Again, this is typically going to be if you get a cold sore or fever blisters around your mouth, the virus can cause vertigo if that flares up after the dental work. And then vertigo from a bacterial infection or an abscess. The other one I mentioned in this video that's not on this article is potentially triggering a migraine or a vestibular migraine after a dental procedure, just due to the aggravation of the head and neck area. I hope that video was helpful. I'll see you in the next one.